Welcome to Mom Matters, created by moms for moms. It's a safe space for moms to lean in and support each other, and also for us to discuss difficult topics that are important for us to highlight because they can impact our health and our well-being. Topics like the one that we are discussing today, which is pelvic health. We have Dr. Lisa Perillo here. She's going to explain a little further. Dr. Perillo, it is so great to have you.
Thank you for having me.
Okay, pelvic health.
Yes.
I know women know the term pelvic floor, right?
Yes.
However, truly understanding its functionality, what it is, and why we should care about it, I think is something we need to talk a lot more about.
So the pelvic floor is a group of muscles and ligaments that sit at the base of your pelvis, and it supports your bladder, your vagina, your rectum, basically all of sort of the organs that live inside the pelvis. And it's important because your pelvic floor functioning well dictates whether or not you urinate well or your bowel function is good. It can affect sexual health and well-being. And in fact, the pelvic floor actually plugs into all of the other muscle groups in your legs, in your abdomen, in your back. So back pain can be related to your pelvic floor. Abdominal pain can be related to your pelvic floor. It's really quite special in that way. With childbirth, women can have issues with their pelvic floors. As we age, our pelvic floors can get damaged, weaker. And then, you know, there are ways to throw off your pelvic floor by exercising too much or lifting something wrong. And so even just in day-to-day life, women can unconsciously cause issues with their pelvic floor that can affect pain and other symptoms with the bladder or bowel.
Okay, so let's talk about that though. What are some of the most common things that you see when a woman comes into your office?
So I see a lot of women that have both incontinence, so leakage of urine, and then prolapse, so where the bladder, the vagina, the rectum are sort of falling down.
Let's talk about urinary incontinence.
Yeah.
How common is that?
So about 45% of all women actually have some form of urinary incontinence.
Wow, 45%.
It's a huge number, yeah.
Okay.
Yeah.
What about prolapse?
Similar, like 45 to 50% of women are affected.
Why is it important that we talk about this?
Yeah. These are really important quality of life issues. You know, women are living with leakage or pain or discomfort or not feeling like they can engage in intercourse in the way that they want to. And I think it makes life harder, and why should women have to live like that?
Yeah, why
There are things we can do to help.
Okay, so like what kind of things could we do?
Yeah, so there are some behavioral and lifestyle changes that can help with these issues. Pelvic floor physical therapy can be very helpful. And then there are also certain surgical procedures that can help with both.
Okay. If someone thinks that they have these types of symptoms, or they're curious, or they're concerned, what should they do?
They should come see a urologist. They can certainly talk to their primary care doctor, get a vaginal exam, or their gynecologist, but we're also happy to have them come see us.
Okay, so go see your provider first and foremost.
Please.
Talk to your provider and see if you can get a referral to a specialist if needed. Dr. Perillo, thank you so much.
You're very welcome.
Greatly
Thank you for your
appreciate
time.
it.